Hello and welcome. My name is Rochelle Swartz. I do go by Nico. Um, I'm getting ready to go over America's healthcare and its association with the 1997 movie As Good as It Gets, starring Jack Nicholson and Helen Hunt. Jack Nicholson stars as the character Melvin Udall. If you haven't seen this movie, it came out when I personally was in seventh grade. And at the time, I hated it. It's been a very, very long time since I've seen it. And when I saw it on the list, I was not going to watch it because I hated the movie so much. My mom used to watch it over and over again, and I just kept coming back to it. So I ended up watching it, and I'm really, really glad that I did because watching it from this perspective with this class absolutely changed how I viewed the circumstances in the movie and how I viewed some of the characters that I wouldn't have had previously. So as good as it gets, this movie is centered around a man named Melvin Udall and the interactions he has with individuals in his life. He is a very successful author living in New York, and he also has a diagnosis of OCD. He has this diagnosis to the extent that he cannot step on cracks, he cannot step on tiles that are the edge of them. He has to step fully within a tile. He cannot have strangers touching him. He must do repetitive things like locking his door over and over and over to make sure it's been done. And he wears gloves with everything. And then he throws them away, whether they're leather gloves, plastic gloves, it doesn't matter. He doesn't touch things, he doesn't get touched. Melvin is also a miserable person and a terrible example of a human being. He acts crashly, speaks rashly, and has a temper that gives him no disregard for others. Once Melvin looks outside of himself and sees how he has affected someone, he's kind of an okay person. So, how does this, excuse me, start to interact with the American healthcare system? Well, enter in Simon, his neighbor, is a very successful artist who does not have health insurance. He is brutally attacked during a home robbery and is hospitalized for many weeks. He finds himself having to let go of staff, sell most of his belongings, and his apartment has been sublet from underneath him. Simon essentially becomes impoverished due to one healthcare incident, not even of his own making. So, with the uninsured, the number of uninsured people in 2017 was 28.5 million. 84.6% of those people were 19 to 64 years old. The costs of insurance and job loss are major contributors to being uninsured. However, one thing that this movie made me start thinking about was Simon is self employed, therefore, does not have the option of having a plan provided by an employer. Simon was a very successful person, but he was within an age range and somewhat in his prime. So he probably felt as though he didn't need the health coverage because he was probably never sick. And then suddenly his life got turned upside down because of one healthcare incident. It is baffling to me how our system is set up so that people can be successful and then one failure can take away everything. Um, one car wreck away from having nothing essentially. Um, so now we move on to as this movie is centered around Melvin Udall and the interactions that he has with individuals in his life. We're going to meet Carol. Carol is a waitress who has a son, Spencer. Spencer has really bad allergies, what I'm suffering from right now, and that has lead to asthma attacks. Her provider told her that her HMO doesn't cover an allergy test, leading to no real resolution and plenty of ED visits. Plenty, plenty, plenty. Now, we just said that Carol is a waitress. ED visits are not cheap, right? Um, they come with a much, much higher cost. And um, she has a provider and she has an HMO, and yet she's still having to go to the ED many, many times. But Melvin needs Carol as his waitress. He needs her because he's got OCD. And that's one thing in his life that he needs to be the same who his waitress is. So he finds a workaround and sends a doctor to Carol's house to treat Spencer. Is what it is. He also will pay 100% of that cost. Now, remember, he's a very successful author. Very, very, very successful author. For him, this cost is nothing. The cost of paying these medical bills is much less than the anxiety that he will feel from not having Carol as his waitress. So there's so many things that I could go into this movie about um, relating to this course and other courses with public health. It's pretty phenomenal, actually. And I'm still very glad that I chose this movie. So this doctor comes to Carol, is at Carol's home, and asks Carol if her son's providers did any allergy testing or any standard skin testing, to which Carol says her plan wouldn't cover it, and they say it wasn't needed anyway. Carol um, then asks the doctor, should they have? And he doesn't actually respond, but it's kind of a hmm. So Carol then says some very colorful opinions of her HMO and then apologizes to the doctor, who um, then basically tells her he thought that that was the HMO's official title. So looking at this and looking at that statement that he makes, the standard skin testing isn't covered by her HMO. Let's talk about HMOs. Um, right after we talk about beneficence, that requires doing the best one can for the recipients of one's servants, for the recipient of one's services, balancing of treatment versus the risks and costs involved. For a health administrator, this would mean using the full array of their skills for all patients, regardless of the ability to pay. Regardless of the ability to pay. It is doing the best that one can with what they have. So when it comes to managed care plans, they are used to manage health service, and they do that through the cost, the quality, and the access of the health service. And they control them through mechanisms on both the patients and the providers. Now, Carol's part of an HMO, which uh, falls under the managed care plan, and members are enrolled in the HMO, and they pay a fixed prepaid amount. Enrollees are eligible to get care from providers and facilities, and they get these services provided at no charge. Now, the administration is centralized, and provider reimbursement, I apologize, provider reimbursement is at a capitated rate, which means that it doesn't matter how much work is done or isn't done. The provider will be paid the same amount. So, think about first, Carol's new unexpected surprise gift doctor asked her about the standard testing, to which she said no. Then we saw should be able to do our best for the patient, regardless of the ability to pay. But then we also look at, well, the reimbursement. And, in New York, they're probably pretty busy. So my references for the uninsured amount was from the textbook. But The movie As Good as It Gets. Um, I'm really glad that I brought that together, and I know that I have made this very, very long. However, there's so much more that I didn't even cover, and I don't know how to make it any shorter. And it really is just such an interesting view of the American healthcare system and how really broken it is. And we can do better than good. Thank you.